Hey guys, Dr. Tank here and welcome back to my channel. Today we're talking about chest pain. The goal of this video is to help you understand chest pain by talking about the different types of chest pain, what you can do at home to take care of yourself, and what you can expect when you come to the ER when you present with chest pain. I'll also discuss some of the different diagnostic tests that are available and what you might expect to receive if you do present with this. So let's dive in. Chest pain is the second most common complaint we get in the ER, accounting for more than 7 million visits last year. So what are the different types of chest pain you might have? One is what we actually worry about, which is called cardiac chest pain. This is typically described as a squeezing or tightness over the chest, or a feeling that something is sitting on your chest that usually persist and does not go away. It can sometimes be worse with exertion, which means the feeling is more intense when you walk around and gets better if you rest. It can be associated with different things such as nausea, sweating, and it can sometimes radiate to your arm or to your neck. If this lasts for an extended period of time, it's definitely more concerning. The second type of chest pain would be considered non-cardiac chest pain, although a vague term basically encompasses all the other types. This can include things like pulmonary chest pain. For example, if you're having a collapsed lung, a lung infection, a blood clot in the lung, or any other type of mass that could be causing referred pain in your chest. There's also different GI types of chest pain. GI stands for gastrointestinal. So this can include things such as gastric reflux, hiatal hernia, peptic ulcers, or even more serious conditions such as esophageal tear or rupture. A common cause of chest pain that you don't need to worry about is something we refer to as musculoskeletal chest pain. Basically, it's inflammation of your chest wall, whether it's the muscles between your ribs or the pectoralis muscles or the muscles around the chest. This pain is typically reproducible, which means that you move your body in a certain direction and the pain does come back. Usually there's a history of overexertion, exercising too much, or sometimes it can just happen from sleeping wrong. Again, this is one of the less dangerous causes of chest pain that are out there. So how do you know what kind of chest pain you have? Well, it's not your job to know. If you're having chest pain and you're worried about it, long story short, you should go see a medical health professional. Next, we're going to talk about what you can do at home if you are experiencing chest pain. First thing I would recommend is to take some rest and not exert yourself. If you are experiencing a heart attack, you don't want to make it worse. Also, most of the other conditions that are serious would be worsened by activity. If you think your pain is more muscular, you can always take a pain medication such as Tylenol or ibuprofen, assuming you have no allergies or contraindications to taking these. If your doctor has prescribed you nitroglycerin to use in the event of chest pain, you can also take this, but be warned not to take it with Viagra or other phosphodiesterase inhibitors, as this can drop your blood pressure significantly. Now you decide to come to the ER with chest pain. What can you expect? Well, in addition to your typical vitals, history, physical exam, you're likely going to obtain an EKG soon upon arrival. So the EKG records your heart activity in that instance of time and can give us a lot of useful information. Keep in mind that an EKG does not tell us everything, and likely we're going to need some blood tests as well. You might even get an x-ray of your chest. All in all, what happens next will be up to your medical provider. Typically, when I see patients with chest pain, I'm keeping a broad differential and I'm making sure that I try to rule out all of the serious causes it could be. Now, sometimes we don't get to the bottom of it during your ER stay, at which point you might experience one of two things. Your doctor might want to repeat the test, such as get another EKG or another blood test. They may want to consult with a specialist. They may want to admit you to the hospital for observation, or they may send you home with the proper return and follow-up precautions. So these are the key points I want to leave you with from this video. I'll likely get into the details of the different causes of chest pain in another video. That's all for now. Thanks for watching.